MASLD, the new term for fatty liver or non-alcoholic fatty liver disease, as we knew it before, NAFLD. So now it is called metabolic dysfunction associated steatotic liver disease. What is fatty liver, or the spectrum of fatty liver, or MASLD?
Naturally, fatty liver disease or discussion on fatty liver disease come into the context. The spectrum of fatty liver disease is from simple fat deposition in liver to cirrhosis or hepatocellular carcinoma, and there are certain stages of fatty liver disease. The benign-most stage is fatty liver disease or fatty liver, and then comes the MASH or metabolic dysfunction associated steatohepatitis, when the deposited fat is causing inflammation or inflammatory injury to liver, that is called MASH. Now comes the stage of fibrosis and cirrhosis. Now in cirrhosis we divide it in compensated stage and decompensated stage, and finally comes another dreaded complication, that is cancer of liver or hepatocellular carcinoma.
Who are more affected by fatty liver?
Fatty liver disease, as we knew in the past, that it is a disease of liver, but it is not a disease of only liver. It is a systemic disease and it is a metabolic disease, because fatty liver is one thing. When fat is deposited in liver, it is fatty liver, but fatty liver disease is something different. Many people have black lines over the neck, so that is called acanthosis. That is a telltale sign that he or she might be having fatty liver. Some people have
Good morning. Here we are back again with a new podcast, and today our topic is fatty liver. Hello, I am Dr. Riya Shah, medicine consultant, and here we have with us Dr. Trishanu Boni, DM, gold medalist gastroenterologist. So, coming to our topic today, it is MASLD, the new term for fatty liver or non-alcoholic fatty liver disease, as we knew it before, NAFLD. So now it is called metabolic dysfunction associated steatotic liver disease. So, sir, my first question to you will be, what is fatty liver, or the spectrum of fatty liver, or MASLD?
So it's a very important topic as well as very important question in this festive season, because this is the season of eating foods, trying new things. So naturally, fatty liver disease or discussion on fatty liver disease comes into the context. So the spectrum of fatty liver disease is from simple fat deposition in liver to cirrhosis or hepatocellular carcinoma, and there are certain stages of fatty liver disease. The benign-most stage is fatty liver disease or fatty liver, and then comes the MASH or metabolic dysfunction associated steatohepatitis, when the deposited fat is causing inflammation or inflammatory injury to liver, that is called MASH. And now comes the stage of fibrosis and cirrhosis. Now in cirrhosis we divide it in compensated stage and decompensated stage, and finally comes another dreaded complication, that is cancer of liver or hepatocellular carcinoma. So these are the stakeholders in the spectrum of fatty liver disease.
So who are more affected by fatty liver?
Mostly obese people. Look, fatty liver disease, as we knew in the past, that it is a disease of liver, but it is not a disease of only liver. It is a systemic disease and it is a metabolic disease, because fatty liver is one thing. When fat is deposited in liver, it is fatty liver, but fatty liver disease is something different. So there comes the role of certain other things, like if a person along with fatty liver having diabetes or pre-diabetes, fasting blood sugar is above 100, or dyslipidemia, means triglyceride is above 150, or HDL is below the cutoff that is for Indian men it is less than 40 and female it is less than 50. If there is hypertension, blood pressure is more than 130/80, or there is central obesity, the abdominal girth is above 90 centimeter for men and 80 centimeter for women. So along with fatty liver, if any of these things happen, then we call it as fatty liver disease, and the term fatty liver disease denotes involvement of our whole bodily system, so it is a systemic disease.
So among male or female, who are more affected? Is there any predilection?
No, as such there is nowadays there is no much gender-based distinction or differences in prevalence. As we see today that around 40% of people are affected by fatty liver. So 4 to 5 persons out of 10 persons will get fatty liver. But yes, if you and also it is a disease of all ages, children as well as adults and elderly can get fatty liver. But yes, if you ask the gender predilection, then fatty liver disease is as we know that after the menopause for women there are many hormonal imbalances. So whatever the gender difference is, it narrows at higher age group. So there is it is not very clinically significant to identify the gender difference, but to identify the predisposing factors or other associated conditions is more important to identify and treat fatty liver disease.
So what are the symptoms a patient can get when the patient is suffering from fatty liver?
Look, for fatty liver disease there is generally no symptoms because most of the patients are asymptomatic, and most common clinical scenario when we diagnose fatty liver by some abdominal ultrasound, which is being done for some other reasons. Suppose a patient is coming with pain in abdomen or a routine health checkup. So abdominal ultrasound is a foremost investigation that we prescribe, and once there is deposition of more than 5% fat by weight in liver, we diagnose as fatty liver. So most of the patients are asymptomatic. There is no symptoms at all for fatty liver per se, but there are some physical clues. Looking at them, we can tell that yes, these persons might have fatty liver. Like you have seen that many people have black lines over the neck. So that is called acanthosis. That is a telltale sign that he or she might be having fatty liver. Some people have short neck. You see that after the chin, after the jawline, there is shoulder. There is nothing in between, and the whole area is flat. And if the neck circumference is, if your shirt collar circumference is more than 16 or 17 inch, then there is high chance that that person is having fatty liver. So these are the very telltale signs of fatty liver disease. And suppose a person is having abdominal central obesity, a huge abdomen, so there is also a chance of fatty liver disease. And from medical history, if somebody is suffering from high cholesterol level, somebody is suffering from diabetes, there is increased chance of fatty liver disease. So fatty liver per se is asymptomatic, but the associated conditions will tell you that yes, there is a chance of fatty liver.
But as we progress in the spectrum of fatty liver disease, the patient can have symptoms.
Once we get fatty liver, then obviously doctors prescribe for liver function test, and it is very common finding that SGOT, SGPT levels are slightly raised between 1 to 2 times in case of fatty liver disease. So Fatty liver in USG and asymptomatic rise in SGOT, SGPT level are the most common findings of fatty liver disease.
So, sir, what are some other investigative measures that can be taken for not only diagnosing fatty liver but to prognosticate the disease? What are other novel investigative measures?
Basic investigations will tell you so many things. Blood sugar level, triglyceride level, how is the BP of that person, what is the abdominal circumference. So these are the most important and very easily available tests or clinical examinations which can prognosticate fatty liver disease. There are some genetic factors as well. Uh, you must have seen that there are some lean patients who are not obese, not diabetic, not dyslipidemic, also have fatty liver. So they have some genetic predisposition, like there are two very common genes like PNPLA3 and TM6SF2. These are medical terminology, not important for knowing, but for discussion, that there are some genetic predisposition for fatty liver disease. So although these people are less in number, but there are some genetic predisposition. So basically we prescribe, we clinically examine the patients with simple visual impression or by a measuring tape, and we prescribe some basic tests as we discussed. So these are the tests used to diagnose the metabolic spectrum of fatty liver disease and to prognosticate.
So is there a role of fibroscan?
Yes, there is a role of fibroscan. Once there is increased chance of fibrosis from these basic tests, we can predict if there is any chance of cirrhosis or fibrosis. So once you see that there are some scoring systems, before fibroscan we use some scoring systems from simple blood tests like complete blood count, LFT. So one such score is called APRI, AST2 platelet ratio index. So once this index goes above a certain level, that is 1.3, then we can prescribe a fibroscan of liver, which can detect the amount of fat as well as amount of fibrosis. So it is not for all, because you know that for a simple fatty liver there is a chance of only 1 to 2% in 10 years to progress to cirrhosis. But once there is fatty liver associated inflammation or steatohepatitis, the chance goes up to around 20%. So for vast majority of patients we do not need fibroscan, but yes, fibroscan is a very good non-invasive test to identify patients at risk MASH.
So what are the treatment options in case of liver disease? And I would like to add, what is the role of lifestyle modification in this and the role of diet?
That is the forerunner in the treatment of metabolism, metabolic dysfunction associated fatty liver disease. Role of diet and lifestyle. So one very simple thing we can remember, that for dietary advice, we should take 50% of our daily food as raw foods. So what raw foods we can take? We can take salad and fruits. So these things can be taken before cooking. So whenever you eat, try to take 50% as uncooked products. So that will save your liver. And for lifestyle, you have to maintain a daily physical activity of moderate physical activity for at least 30 minutes and for at least 5 days in a week. It has been seen that if you can run at a moderate pace for 20 minutes, you can walk at a moderate pace for 20 minutes, you will reduce 20%, your liver disease chance will reduce by 20%. So 20 minutes walking is equal to 20% reduction in your liver cirrhosis risk, liver cancer risk. So taking half of the daily food as uncooked and 30 minutes of moderate physical activity is all to respect your liver and save it for your body activities.
And is there any role of medication?
Yes, there is role of medication. In recent times, lots of trials have come up, and we have seen that some anti-diabetic medications also help to protect liver, like SGLT2 inhibitors, dapagliflozin group of drugs, medicines, which has previously been proven to be, proven to safeguard heart as well as kidney, and now it has been proven that it can also save liver. So these anti-diabetes medicines can be prescribed, and there are some other drugs like semaglutide. These are also medicines for diabetes, but these options are very costly. So there are some other groups of trial drugs also, but by simple means, the most cost effective, one medical person would like to reiterate that the most cost effective and most affordable thing is dietary and lifestyle modification. So, but yes, if we need to prescribe medicines, we have plenty of options, 3-4 group of medicines, of which anti-diabetic medicines are cheap, easily available and affordable.
And we have been using vitamin E for fatty liver for a long time. Doctors have been using. What is your take on using vitamin E as antioxidant support in case of fatty liver?
Yes. Look, vitamin E can reduce fibrosis of liver. So for proven fibrosis, we can use vitamin E. But vitamin E most probably cannot reduce fat of liver. So if fibrosis is proven, advanced stage of liver disease, fatty liver disease is proven, we can use vitamin E. But in fatty liver, there is not very big role of vitamin E to reduce fat from the liver.
Also, it has no role in diabetes.
Yes, also there is no much role in diabetes.
And what is your take on using ursodeoxycholic acid, which is widely used in treatment of fatty liver? What is your take on it?
This is basically a core medical discussion, but ursodeoxycholic acid has no role to reduce fatty liver.
So my next question will be, if a patient is not taking his fatty liver diagnosis seriously, is not doing his necessary lifestyle modifications, and the disease progresses, what is the progression? As we have already discussed it earlier, but for patients, what is the, so that they are aware, more aware,
Look,
what is the progression and what are the complications?
Look, fatty liver is the tip of the iceberg, and the imminent danger behind fatty liver is the cardiovascular risk. So it is seen that most people who are suffering from fatty liver will be suffering from cardiovascular disease if not taken care of. So fatty liver is to be taken care of from the perspective of our cardiac health as well. If you ask me what is the risk of liver cirrhosis or liver cancer from fatty liver, yes, it is today it is the most common cause. Diabetes is the most common cause of liver failure, but from fatty liver it takes a long time to develop liver failure, cirrhosis or liver cancer. As we have seen, from simple fatty liver, it is only 0.7 to 1% persons will progress to cirrhosis in 10 to 14 years. And from fatty liver related inflammation, but once there is steatohepatitis, around 1.4 to 2% persons will progress to cirrhosis in 15 to 20 years. So the chance of progression is less, but the imminent danger is cardiovascular disease. So if there is fatty liver, one has to be alerted regarding cardiovascular health.
I hope everyone from our discussion already knows about the importance of lifestyle and dietary modifications. Yet I would like to assert on this again. For prevention of fatty liver and related outcomes, according to you, is the most important step?
Most important step is to maintain the dietary and lifestyle advices to keep oneself active by moderate physical activity for at least 15 to 20 minutes per day, and not to take much sugar, processed and junk foods.
Okay. Thank you, sir, for this discussion on a very
Thank
important
you.
and pertinent topic. I hope everyone will benefit a lot from today's discussion, and today's takeaway mainly will be fatty liver per se is not a very dangerous diagnosis. Although if left untreated or not given importance, it can progress over time, and it's associated with other outcomes, other health outcomes like cardiovascular disease, and it can also it's associated with the metabolic spectrum, which can also worsen, and the risk factors are almost same for all. So lifestyle modification and dietary modification remains the most important step for everyone, and I hope everyone will take this seriously.
Thank you.
Thank you, sir.